Welcome, Dr. Weismantel. Thank you for sitting down and talking to us today about student safety in the time of COVID. I really appreciate it. Can you tell us a little bit about what a university physician is and what your role is here on campus?
A university physician, I guess, for purposes of this conversation, primarily is the public health officer for the university. So I've spent a lot of time over the last several months working on our plans for returning students to campus for their education. Um, and also as university physician, I oversee the student health services and counseling and psychiatric services as part of another role, actually as executive director of student health and wellness, but I'm very well versed and have responsibility for those areas.
Wonderful. Dr. Weismantel, what's the best way for students to avoid contracting COVID as they come to Michigan State?
The best way for them to avoid contracting COVID is to be sure to wear their face covering at all times when inside and out. To keep at least a 6-foot distance from others whenever practical, and to practice good hand hygiene by washing hands every half hour or hour and or using alcohol-based sanitizers. Those are the main ways to avoid getting COVID-19.
It seems pretty simple and doable. Why is it so important that students avoid getting COVID when we're hearing so much in the media that it maybe doesn't affect them as much?
Well, it's really important because any individual doesn't know if they're that one person that may get very sick, even as a young person. And really, our greatest concern is the ability for any person with COVID to spread it to others. Others that may be older, may have other health conditions, or that may not weather it as well as you might. And so that is the main reason we try to avoid getting COVID, is actually the protection of everybody and those that we care about.
And I would say from the residential and hospitality services perspective, we have many of our team members who are janitors who are serving food who fit into that high risk category.
Absolutely. And probably a lot of the people that work in your facilities and otherwise. And
Absolutely.
right. And so they are all instructed with the same things, though, to wear a mask at all times when you're at work and to keep that 6-foot distance from others at all times. So we're given the same instruction to everybody.
Very good. So how can students protect their mental health when they're spending so much time alone and in virtual spaces?
Well, mostly is to make sure that they keep up their social connections that they maybe had previously, and even if that needs to be done virtually. To make sure to socialize with others that are here on campus, of course, in that physically distanced way, and with masks, but make sure that talking to others, get outside, walk around, get some fresh air. You do not have to spend, all the time indoors, nor would we expect that. It's a beautiful campus, get outside and enjoy it. And if, despite doing these things, being involved, reaching out to others, if having any trouble, reach out to our counseling and psychiatric services, and they will be able to help assess and also help give you other strategies to stay well, or if you're not feeling well, how to get you better in a mental health way.
Perfect. How will testing for COVID-19 work for students on campus?
Uh, Testing for symptomatic students on campus, 2 ways for people to access testing. One is if they are really not feeling well and are ill, they can schedule an appointment at the Olin Health Center, Student Health Services, and upon evaluation by a provider, testing would be done, and that testing will typically, results are returned within an hour or two. And then there will be other testing available on campus. I believe we're setting that up right as I speak, at the East Concourse of the stadium. And that is just walk-up testing available there, and availability to do many hundred, maybe up to 1,000 tests a day at that site. So 2 places that I can name on campus right now that the more typical diagnostic testing is done. And in addition to that, we will be gradually phasing in a surveillance program, saliva-based, program where students have the opportunity to opt in, and people will be selected each week or each day actually for random testing on campus. And there will be more communication going out about that and how students may participate in that program.
Very good, thank you. Why are we requiring students from some of these hot zones in our country and other countries to quarantine when they arrive?
Yeah, you know, upon consultation with our local health department, we've noticed actually over the last several months, many of the cases that we've had in the county and even on campus over this period of time, many of them have been attributable to people actually going to those hotspot states and coming back. And so the best way we can protect our community is for those people coming back from those places, for them to self-quarantine for 14 days, basically the infectious period for COVID-19, prior to interacting with others on our campus and in our county. And right now, there are, I think, 8 or 9 states on that hotspot list, and most of our students are coming from states that are not on that list.
And so how is quarantine different from isolation? We're hearing both those terms and it can be a little confusing.
Yeah, both refer to separating yourself from others, but quarantine is done for people who have been exposed to the virus. And meaning, we say self-quarantine if coming from a hotspot state, and that is us saying that you have been exposed to an environment where there is more of the virus than we have here. And then at other times, it may be that you're a close contact of somebody that has actually been diagnosed with the virus, and then you'd be asked to self-quarantine in those circumstances. So quarantine are done for people who are healthy that have been exposed, and the term isolation is used for those who have symptoms or have been diagnosed with the virus. So if you have some of the symptoms and you may need a test, we will be asking people to self-isolate during those times until their test result is back. If it's negative, they're released from that self-isolation. If it would be positive, that period of isolation would continue because of the positive test.
Well, thank you, Dr. Weismantel. All this has been so helpful, and everyone should remember that more information and updates are always posted on MSU's Together We Will website. Thanks again, Dr. W.
Thank you.